This is the second recording of explanation of psychiatry, second exam. So just talking up here, we got to understand that a lot of these psychiatry medications affect different receptors, and these particular slides are talking about dopamine receptors. So dopamine 2 receptor has effect on several different parts of the brain, and in each part of the brain it has a different sort of effect. So up here at the top here is the mesolimbic mesocortical pathway. So when dopamine receptor is blocked here, the effect it has in the mesocortical mesolimbic area is that it reduces the positive symptoms of schizophrenia. Okay, so schizophrenia has positive symptoms and it has negative symptoms. The positive symptoms are the hallucinations, the delusions, the agitation, whereas the negative symptoms, which this does not affect in the mesolimbic mesocortical system or pathway, are going to be things like the flattened effect, or the silence with the not speaking, not communicating, the social withdrawal, the not taking care of oneself, that sort of thing like that. So kind of think the word meso means, I believe, medium in Spanish. So kind of think that it takes this person that's got these positive things and it makes them become medium again, the dopamine blocking there. So as far as adverse effects, don't really worry about that too much. Going down here, the nigrostriatal pathway. So the only thing that blocking dopamine here is negative effects, and this is in fact one of the main negative effects found in typical and atypical antipsychotics, and they call them these Parkinsonism-like disorders, dystonia, akathisia. It's where the person starts moving as if they have Parkinson's disease, and it's because dopamine is being toyed with here, and dopamine is associated with Parkinson's disease. And so this is one of those adverse effects when a person takes too much of it. They start getting these symptoms. And actually, the other interesting thing is, even if they're just taking the right amount, but they take it for a long time, sometimes the body can respond by increasing sensitivity. They get a hypersensitivity to it. And so what the body will do is it'll put down more receptors, is the theory with the hypersensitivity. And when this is the case, they actually giving them more of the drug will make the symptoms go away, and taking away the drug will make the symptoms worse. So it's kind of an interesting reverse thing there, and they call that the tardive dyskinesia, whereas when it's the short term, taking too much of the drug, they call that Parkinsonism. So that's the effect there of the nigrostriatal. So now we're going down here to the tuberoinfundibular pathway. So we understand that up in our hypothalamus, we have this anterior and posterior pituitary, and in the anterior pituitary we have these cells that secrete something called prolactin, and prolactin it has an inhibitor, and the inhibitor on prolactin is dopamine. So here, if we start playing with dopamine, with our dopamine receptors in the tuberoinfundibular pathway, it's going to increase the prolactin secretion by the hypothalamus. And so sometimes these people, when they're on this drug, will actually start having effects of having too much prolactin. What does prolactin do? Prolactin causes effects with the breast. Okay, so the milk discharge, that sort of thing. Breast growing, gynecomastia in men, perhaps. Okay, so now the other one here is the receptors, D2, D3 family. Don't worry about those too much. All right, coming down, we have serotonin. So serotonin, all these drugs, atypical and typical antipsychotic drugs, they don't just affect dopamine. Okay, they also affect serotonin, they also affect histamine, they affect muscarinic receptors, they block alpha adrenergic receptors. They have a lot of effects, and a lot of these effects are the adverse effects from these. So serotonin The good thing about the serotonin effect, though, is that it actually improves some of the negative symptoms of schizophrenia. Remember what those are: the flat affect, the avoiding social interaction, the not speaking, those kinds of things. So if you block, the serotonin effects are going to get rid of the negative symptoms. And so the difference between the atypical and the typical antipsychotics is that the typical antipsychotics are more dopamine affecting than they are serotonin affecting. And this means that the dopamine blocking ones are going to have more of normalizing that mesolimbic pathway, causing the the positive symptoms to go away of schizophrenia, whereas the serotonin, the atypical antipsychotics, they have more of an effect on the negative symptoms than the other ones do. They also do the positive symptoms, but they get rid of some of those negative symptoms as well. And that's because of the serotonin, because they have a little more serotonin than they have dopamine. So what's an adverse effect, though, of the serotonin, though? Weight gain. Histamine. No known therapeutic effects, but it does cause sedation and weight gain. And that's one of the reasons why sometimes people will go for something like maybe Bupropion or something like that, because it doesn't have as much sedation. In fact, it has a little bit more CNS activity. It also is going to have the receptor blockade with the muscarinic receptors. And what this is going to do is actually it's going to have reduced manifestation of D2 inhibiting drug-induced movement disorders. So remember that Parkinsonism. This is gonna be on that same plane, kind of counteract that. Adverse effects: loss accommodation. That's the eyes. Dry mouth, difficulty urinating, constipation, and delirium. And then we have the alpha adrenergic receptor blockade blockers. And this may help with some mixed psychotic illness, but particularly some post-traumatic stress disorder. But the adverse effect, though, is going to be orthostatic hypotension, impotence, and even ejaculatory disorders. And so those are adverse effects. Another reason to switch over to Bupropion, because it doesn't have those it doesn't affect libido and that sort of thing. Okay, now we're talking a little bit about mood disorders here. The other video we talked about quite a bit. We went through all of them. In this one, just understand that the drugs that are going to affect the mood disorders are going to have effects on serotonin, also known as 5-hydroxytryptamine, norepinephrine, dopamine, and there's a theory that these mood disorders, because of an imbalance of these neurotransmitters, the serotonin, dopamine, and norepinephrine. And that another theory behind depression is that there's a reduced amount of something called brain-derived neurotrophic factor. Now, what is brain-derived neurotrophic factor? It's basically something in our brain that helps the brain have some plasticity and to regrow and repair itself and these kinds of things. And if it doesn't have enough of this BDNF, or brain-derived neurotrophic factor, then it's going to result in some brain atrophy. And the atrophy in specific places is what results in some depression. And apparently, normally, the cells will, when they do their job, they're going to do it through lots of different receptors, but one of them is the tyrosine kinase receptor B. And they found this decrease in instances of people who have reduced brain-derived neurotrophic factor, and it's related to stress. Another thing they've also noted is that the thyroid function test is abnormal in 1/4 of depressed patients, and if they address the thyroid issues, that it'll correct it lots of the time. So here we have our arsenal: SSRIs, SNRIs, TCAs, MAO, inhibitors, bupropion, mirtazapine. There's more. Tell you what these mean. SSRI, selective serotonin reuptake inhibitor, which means it's putting more serotonin in the synaptic cleft. SNRIs, serotonin norepinephrine reuptake inhibitor, the TCA stands for tricyclic antidepressants, and MAO stands for monoamine oxidase inhibitor. The monoamine oxidase is something that breaks down basically the things involved in those synapses, and so if you leave this in there, then you're going to have more of these. You're going to have more of them around, which is going to help the people feel better. But the problem is that there's so many adverse effects. Bupropion is a norepinephrine, dopamine, I believe. We'll come to it. I don't want to guess on these. I can't remember off the top of my head. Here it is. Norepinephrine, dopamine. Yes, bupropion. And then there's mirtazapam, which is found. Here it is. This is a serotonin 2A, 2C, HT3 as well effector. So this is an overview, and there's some pictures on here, and I'll explain these pictures and what they mean shortly. But I would be familiar with this. See how I have the SSRIs over here. I have the TCAs over here. I have the MAOIs over here. The SNRIs over here. Let me explain really quick what these mean. I'll go into more depth later. This is a flying ox, or a flu ox, the ox that flew, because it has a wing. There's fluoxetine. Remember it there. This is the tricyclic, and this person apparently is named Amy, amitriptyline. So you're thinking the Amy tricycle. Over here is an SNRI, or a snow ride, and there's a dual oxes pulling it here. And this is apparently Mao Zedong. So here's MAOI, looks like Mao. And we'll go into that in more detail, starting right here. So SSRIs. There's a serotonin transporter, the SERT protein. This is where this drug takes its effect. Normally, the serotonin binds to the SERT, or the serotonin transporter, which then allows sodium and chlorine into the cell. SSRIs inhibit serotonin from binding to the SERT, which basically inhibits that from occurring. So they also do some binding on these things as well. So here is the way that we're going to remember this. So SSRI kind of looks like sorry. SSRI, sorry. Sorry. So you say, I'm certain that this is the certainly sorry ox. Okay? This ox is certainly sorry. I'm going to tell a little story about it that's totally nonsense, but maybe it'll help you remember it. Okay? So the reason why you're certainly sorry is because this ox shows up in your nightmares. Okay? So he comes from this two-dimensional vortex into your nightmare, and you were dreaming while you were sitting in this chair as we were having the nightmare, sitting in this chair. And this ox shows up as a flying ox, and the ox has a flu, and so it tries to eat a pear to feel better. Okay, so now let me explain how all this fits together. So this ox, the flu ox, well, first of all, I back up a little bit. Certainly stands for sertraline. So certainly sorry, sertraline. Certainly equals sertraline. There it is. Sertraline, that's a drug on our list. Okay, that's going to help you remember. This is what the ox says. I'm certainly sorry, because it shows up in your nightmare. Sorry stands for SSRI. So sertraline is one of the first SSRIs you should think of. That's the main one I want you to think of, because it's one of my favorites, just because it doesn't have the drug interaction of all the ones we've studied so far. So, certainly sorry. Sertraline, SSRI. Now here is the fluoxetine. So this is the ox that flew, okay? He's got the wing here, helps him to fly. And you notice I couldn't do the wings very well because this is a two-dimensional picture. So here it's a 2D wing. Kind of remember that it's 2D6. Oxes, he's got a little tiny thing there, so think of a low libido on this ox. Why? Because these drugs cause low libido. In fact, a lot of people that are so bothered by this adverse effect that they'll start taking bupropion because it doesn't have that effect. You were dreaming while you were sitting on this chair, So the chair, what do you do with chairs? You sit. So this is citalopram. So you think you sit down here on this chair. So citalopram, sitting down when you have the nightmare. Why do you have a nightmare? Because one of the adverse effects for this is that you get insomnia. So nightmares with sleeping, insomnia, and in this nightmare, coming out of this vortex here which vortex stands for vortioxetine. And notice this is not a three-dimensional vortex, it's a two-dimensional vortex. It's 2d6. Comes this ox, and this ox has the flu virus. So fluoxamine stands for flu virus. And the temperature is 103.4. So 3.4 stands for 3A4, because this fluoxetine, not fluoxetine, fluvoxetine, is metabolized, associated with metabolism of 3A4, CYP3A4. Those are enzymes. Okay, the rest are 2D6. This one's 3A4. And then here we have the pair ox. Just want to make sure this is recording. Indeed it is. The pair ox. You think this, what does this ox like to eat? It likes to eat the paroxetine, okay? But the problem with paroxetine is that these particular pears, will make you fat, okay? So think of the pear-shaped person who's getting fat, because remember, that's an adverse effect of paroxetine, is it causes weight gain. And all of these drugs here on this list are are category C, as far as the pregnancy risk, except for paroxetine. And paroxetine is category D, okay? So I drew the D's here, because she's got size D chest or something. I don't know, some way of remembering that. Category D for paroxetine. And also remember that it is 2D6 drug, so there's two D's there. Now up here I drew a picture of Mao Zedong. Why? Because you do not take SSRIs with monoamine oxidase inhibitors, or MAOs, okay? Because why? It'll cause serotonin syndrome, and that's where your blood pressure gets super high and you can die from that. So that's a dangerous thing. Another thing to remember here is I mentioned that paroxetine will make you fat. Well, it just so happens that fluoxetine will make you lose weight. Well, flying, the wing, represents flying, so is the flu ox, or the flying ox. So fluoxetine, flying will help you lose weight, okay? And that will make you, when you get fat, you can say, wow, I'm really getting super 3D. Well, you get more 2D or more skinny or flat when you lose weight. So remember, that's also 2D6. So hopefully that ties everything in there. Vortioxetine, fluoxetine, paroxetine, sertraline, citalopram, and I didn't include escitalopram because it's pretty much the same thing. It didn't have new information on there. And all these adverse effects. Insomnia, low libido. I didn't include diarrhea. I should have drawn the ox pooping or something. Maybe barfing too for the nausea and vomiting. Serotonin syndrome. And I probably should have put a little egg on his head to remember that it's a headache or head egg. Okay. Going back, remembering, see, now you can kind of see where this fluox comes from. Here it is, fluoxetine, SSRI. Got some pictures to help you remember. Okay, so now we're going to move on to the SNRIs, and these ones are also another class of antidepressants, very similar to the SSRIs, except for they can have some blood pressure effects, a little different than the other ones. They can cause some tachycardia, some hypertension, and the way you can remember this is you think SNRI is the snow ride. The snow ride. SNRI is the snow ride. So the snow ride, this is a sleigh, or some people call it the snow van, okay? So the van venlafaxine, okay? So van for venlafaxine, this is the snow van. So you think of venlafaxine, you go, oh yeah, I know that's an SNRI because it's a snow ride, it's a van. Van for riding in the snow. And then, if you remember, levomilnacipran, Levo looks like levo, levitates. Remember, oh yeah, look it. There was a sled just like this that Santa rides, and it levitates. So you think snow ride levitates, levomilnocipran. Santa's snow ride can levitate. Notice here, there are two oxes pulling this, dual oxes. So what is this? Duloxetine. So remember, duloxetine is associated with a snow ride. And then, how far can these dual oxes take you? Miles. So milnocipran, they can take you far. But if you go that far, your muscles will start hurting, and you may get fibromyalgia. Helping remember that milnocipran is only indicated for fibromyalgia. And also remembering, same thing applies to this one. Don't want to take it with monoamine oxidase inhibitors. On the oxes, I put some livers. Why did I put livers here? Hopefully you can remember the livers on these oxes, and you can remember that duloxetine is associated with hepatotoxicity. Okay? Hopefully that'll help you remember that. Now, remember here also there's two oxes, so that's for 2D6. And then also think that these oxes run really fast. And what happens when you run really fast? Well, your heart beats really fast. So tachycardia. What else happens when you run really fast? Well, you get super sweaty. And when you get all sweaty, you get dehydrated. When you get dehydrated, you get a dry mouth. So SNRIs are associated with being sweaty and having a dry mouth. And hopefully you can tie all those things in to SNRIs. And then when you look here, you'll see, look, there's the snow ride. Snow ride associated with SNRIs, and you can tie all those things in. Venlafaxine, there's the van. Desvenlafaxine is same thing. You've got duloxetine, the dual oxes, milnocipran, running miles, and levomilnocipran because the thing levitates. There it all is there. Okay, now we're going to move over to our next class here. Tricyclic antidepressants. So this is a tricycle because it's a tricyclic antidepressant. This is Amy's tricycle. This is Amy, and she's tripping. Okay, like I guess on drugs or something like that. So Amy tripping, or amitriptyline, and she's on the tricycle. And so I'm trying to take all these names here and find ways to create a story about Amy. Okay. And so we created a story. These are not true facts about her, but we're just going to pretend that these are true facts so they'll help us remember it. So here we go. So Amy loves her tricycle. So it goes back to Amy's tricycle, amitriptyline, and her tricycle. And what she would do is she loved to drink. No. This is enjoy communism, but looks like a Coke. But anyway, she would go to all of her communist meetings on her tricycle. Communism kind of sound a little bit like clommy, whatever, clomipramine. So communism, clommy, whatever. She goes on her tricycle, and she loves to read her book, Mockingjay. Mockingjay stands for amoxapine. So a Mockingjay, amoxapine. So that's her favorite book is a Mockingjay. So if you amoxapine, think of a Mockingjay. Whatever, associated with her riding her tricycle to her communist meetings. She'd just sit there and read all the time. And why did she go? Well, she really wanted to get an Emmy. Okay, so Emmy is Emmy. Imipramine, Emmy. And so she'd go out on her dock all day, doxapine, and she would think about her getting her imipramine, and read her book, The Mockingjay, at her commie meetings, where she ride back home again on her tricycle. And that's the story of Amy. So there you go. Hopefully that'll ties everything in. Similar things with this one. Sedation, dry mouth, that can lead to dental decay. That's the important thing there. Blurred vision, weight gain, sedation, orthostatic hypotension, sexual dysfunction. Lots of problems with these ones. Alright, so there we have. There's the tricycle for TCAs, tricyclic antidepressants, and Amy. There she is. So that'll help tie in there. Remember, we've got our SNRIs, we've got our fluoxetine, our flying ox. And now we're going to move down here to our next class, monoamine oxidase inhibitors. Now I wanted to give a little plug here for something called Picmonic. Now if you're going to go to medical school, I've been using Picmonic for quite a while, and this is a little sample of what it's kind of like, okay? They're actually a lot better. They'll actually read it and explain it, then you can take a little quiz on it and things like that. It's really nice. What they do is they make these silly pictures here, and each little aspect of this silly picture has to do with something that's really important. It's likely to be on the boards, okay? So I chose this one just because it was good. I didn't want to reinvent the wheel. All the ones they make are pretty good. But this one's pretty handy, and this is actually where I got the idea of Mao Zedong, because that's what they use. So this is the guy we're talking about. You don't take these drugs with SSRIs or SNRIs, because the person will get serotonin syndrome and die. Okay, so the way they remember this was take pride in Shanghai, or you could just think taking monoamine oxidase inhibitors is the PITS, PITS. There's 4 drugs to be aware of here: phenylzine, isocarboxazid, tranylcypromine, and sledgeline. And so how do they remember these? They had the train zipper. There's the train zipper right there, tranylcypromine, train zipper. They had the phenylzine, or the funnel Z, there it is. They had the isocarboxazid, or the ice carbox. And then they had the sledgeline, or the sledgehammer lion. And they tied all those into here. They recognize these are atypical, for atypical depression is one of the things that can be treated for, and they increase the levels of amine neurotransmitters. So, nice little plug there. Problem with these guys is there are tons of adverse effects. And the list of contraindications on it is just huge, so I filled the whole page with them. This is a big time, like 4th line, last resort for major depressive disorder. So here they are, monoamine oxidase inhibitors, fitting right in there. So now we've talked about our SSRIs, certainly sorry, fluoxetine here. I remember it was eating the pear, had the vortex, the sitting down in the chair, the flu virus is what I had too. Then you've got our SNRIs. Remember it was the van, and it was a dual oxys. It was going miles, and it was levitating milnacipran and levomilnacipran. And then over here we had our tricyclic antidepressants. And we had Amy, and there's a whole big list of these ones, but I didn't go into too much depth. Alright, now we're coming on to our 5-HT2A antagonists. I didn't make a picture for this one because there's only like 2 drugs, and they both end in azidone. So we have trazodone and we have nefazodone. And just understand, trazodone, they say, let's see, how'd they say that? Something about a bone, because it causes priapism. Trazodone. Okay, so I guess they just say trazodone, trazobone, because it gives you a boner that won't go away, and that's called priapism. And then you've got nefazodone. And nefazodone causes hepatotoxicity. And just remember the 5-HT stands for 5-hydroxytryptamine. Alright, so now we've covered these guys, and these ones, and these ones, and these ones, and then we just covered these ones up here, and now we're moving on to bupropion. So bupropion fits in right here. And these ones were listed in one list I saw as second line, although they're kind of, SNRIs and SSRIs, I guess, are kind of sometimes used together. I don't know. I've never diagnosed anyone with any of these diseases or given them any of these medications. So I just say what teachers teach me. So bupropion is used a lot because it does not affect the person's libido. And libido, so this is a good drug for that. And so it causes agitation, though, and insomnia and anorexia, and these are because of its CNS activating effects. Because it's an antagonist of the alpha-2 adrenal receptor. Alright, so now we've talked about our SSRIs, our SNRIs, our TCAs, our monoamine oxidase inhibitors. We've talked about our 5-HT2A antagonists, trazodone and nefazodone. We've talked about bupropion. Last one to cover here is going to be a little other category. Not much to say about these ones, except for this kind of odd here. It's got a 5-HT2A2C-HT3 effect. And the big one they talked about here was the mirtazapine. And it has the weight gain, has the decreased libido, and the sedative. Just has a lot of bad things from all of them. So remember that one, mirtazapine. Okay, done with those. Now we're going to go a little bit into, we can look at this big review here. You could even just pause this video and just try to go through this to see if you can get all these down. Lots of good medications listed there and what they're used for. We're going to go into thought disorders now, though. With these thought disorders, recognize they're broken up into atypical antipsychotics and typical antipsychotics. So the atypical antipsychotics are listed down here, and the typical psychotics are listed up here, and they're divided up. And then over here we have our mood stabilizers. And again, you can see pictures next to all these, and these will make sense as I go through it. So first of all, we're going to be paying attention to these ones up here. So coming down, these are this is what we zoomed up on. So we're at this area right here. There it is, typical. Okay, so these typical ones affect the dopamine 2 receptors more than they affect the serotonin. Okay, so dopamine more than serotonin, which means dopamine is what causes those Parkinsonism effects. So these ones are going to have greater Parkinsonism effects than drugs that would, the atypical, because the atypical are actually more serotonin than they are D2. And also, D2 in the mesolimbic pathway is what gets rid of the positive effects of schizophrenia. So the positive effects, they're not actually positive as in they're good, they're positive as in something is there, and they're not something desirable to be there. They're terrible things, hallucinations and delusions and disorganized speech and all these things like that. Those are not positive. They're not good things, but they're positive as in they're present. Whereas the other symptoms, the negative symptoms, take things away, like taking away speech and taking away cleanliness and taking away social interaction and taking away being emotionally affected, turning into that flat affect. So, in review, atypical, mostly remove positive symptoms of schizophrenia. It's a typical, right? Typical. And atypical are going to get rid of both the positive symptoms, and they'll also get rid of the negative symptoms, bringing them back to normal. So they actually cover more things. So starting here with the phenothiazines, we're going to cover those first. So we're zooming up on this little section here, and here they are, the phenothiazines. So I tried to figure out a way to get these down, and here it is, the phenothiazine. So I've got the phone here. There's the phone, and you're going to see a little bit why it has has wings on it, hopefully. So how do we remember these? So the phone. This, if we just move the E and the O, replace them there, they got phone. Okay, so the phone ones. Everything associated with the phone. Why is this important, the phone? Well, there's a story here. Whenever the phone rings, this is Thor's magic phone. Anybody can call this phone and ask for help to go get the bad guys, the perpetrators. Here they are. He goes and gets the perpetrators. But he's torn because he either can spend his time getting the perpetrators, or he can go rescue his wife, or spend time with his wife who's wearing a prom dress that has breastfeeding access to it. Okay, so he can either go get the perpetrators, or he can go spend time with his prom dress lady. So what does he do when he's waiting for his phone to ring? Well, he just sits here sedated in his chlorine pool. Okay, so now let me explain all this, what this all means. So we have these different drugs, chlorpromazine. So this is the chlorine pool. Okay, chlorpromazine, chlorine pool. We have Thior, or looks like Thor. This is Thor. Okay, we have fluphenazine, which looks like flu phone, or the flying phone. So here's our flying phone. Also happens to be phenothiazine, which is the phone. So it's the flying phone. We have prochlorperazine, same thing, prochlor, whatever. And then we have Phenyzine, which is per for perpetrators. So here's the perpetrators that he goes and gets with his Thor hammer. And then we have promethazine, and a lot of perpetrators use meth, so you can think of that associated with them. Important thing here, oh sorry, not prom, goodness gracious, I made a mistake. Promethazine. This is a prom dress, okay? She's wearing a prom dress, and it's important here, I drew the prom dress had access to, for breastfeeding. There's dresses that women wear that have access for breastfeeding so that women don't have to take their whole dress off when they feed their baby. And this is important because one of the adverse effects of phenylthiazines is that they cause prolactin release because they're dopaminergic effects. And the prolactin release causes milk production. And so, when also pregnancy causes milk production, and pregnancy also causes weight gain. So these drugs also cause weight gain. So prolactin, breast milk production, and weight gain. And think prom dress. This is his girlfriend wearing a prom dress. Okay, so I think that covers pretty much everything here. Just remember that he seizes the bad guys. Remember that there's seizures caused here. Down here I drew a little bit, kind of wrote things out. The meso removes the schizo symptoms. The dopamine's effects on the mesolimbic. Anyway, these kinds of things like this is where they have their different effects and what causes them. I think that covers it pretty well. So now we can go back here and see, there it is. Phenylthiazines, the phone of Thor, right up here. Now we're going to be focusing here. Okay, right here we have Haloperidol. It's the main one I want you to focus on. Yes, there is thiofixine and pimozide and methylene blue and metoclopramide, whatever. Mostly focus on haloperidol. This is the halo poodle, but this is no ordinary poodle. This poodle is acutely psychotic, okay? In fact, it'll even have its eyes rolled up in its head all scary, and its head will be deviated off to one side, and its back will arch up all scary. This is a scary psychotic poodle. Now, hopefully it'll help you remember the symptoms of haloperidol overdose is that your eyes roll back in your head becomes deviated, and your arch becomes back. And haloperidol poodle, used for acute psychosis. So when people have instances where they're acutely psychotic, it's really bad, this is a very highly potent drug. You can give this to them and it should treat it. It has a low hypotension effect, but it does have pretty high extrapyramidal adverse effects, and keep track of it. And there we are, there's the halo poodle right there. Kind of remember where these things are spatially. There's a part of our brain that keeps things organized according to where they're located, and if you can keep these things so where they're located, it can help you to recall them. Oh yeah, up at the top here was Thor, and over here was Halo, and these are over in the atypical corner, and down here's the typical corner, or see, this is over up in the typical corner, these are down in the atypical corner, over here is the mood stabilizer side. So anyway, now we're going to move from the typical antipsychotics, which were more dopamine 2 receptor than they were serotonin blockers, through their G1 antagonism. Now we're going to become ones that are more serotonin than they are dopamine. These are the atypical drugs. We're going to cover these ones down here first, okay? So these first ones here, Orlando, this is Orlando Bloom. The elf guy, he was always talking, I don't know if you noticed, the elves never talked in a normal voice, it seemed like in that whole movie. They were always whispering like this. Quiet, whisper, and quetiapine, or quetiapine, and risperidone, or whisper, quiet, whisper. So here's Orlando saying quiet, whisper. Olanzapine for Orlando, quetiapine for quiet, and risperidone for whisper. Well, all that whispering, he ended up gaining some weight. Here he is. He gained some weight. Why? Because these drugs cause weight gain. Okay, remember that. Orlando, quetiapine, risperidone cause weight gain. And however, quetiapine can really quiet down your Parkinsonism. Okay, so if you switch over to quetiapine, your Parkinsonism can go away. That's a good thing. Those are the first ones paying attention to here. let's move on to the next group of atypical antipsychotics. So now here we have our Orlando saying quiet whisper for these drugs down here. And up here we have Thor on his phone, the phenylthiazines. So now we're moving on to the other atypical antipsychotics, and I tried to tie them all into a closet for the first one on the list, which is clozapine. Okay, so I tied them all into a closet. These are atypical antipsychotics, the rest of them. And so here's what I tied in. So this is clozapine, stands for this closet. Ariprazole, these clothes, some of them are ripped, and that's stylish. Okay, so a rip, they're ripped. Loxapine, lox sounds like lots. There's lots of clothes in this closet. Not really, but anyway, loxapine. And a centipede. Now that sounds to me like a centipede. So the guy really liked centipedes, so he painted centipedes on all of his drawers. And then we have Haloperidol for loaper's shoes. And down here he's got his loapers. So closet, ripped clothes, lots of them, a centipede, and his loapers. Okay, that gets most of them. Somehow I missed ziprasidone, which is really funny, because the clothes here, almost all of them have zippers on them. So ziprasidone is one I somehow managed to forget. I apologize. Ziprasidone stands for the zippers. So clozapine, closet, ariprazole, ripped, lots of them, loxapine, a centipede, a centipede, haloperidol or lopers, and then the ziprasidone. Important one to remember there. So important things about these, though, is that ariprazole is a low weight gain drug. Remember, olanzapine, quetiapine, risperidone, those cause weight gain. Well, if the person who's gaining too much weight was really upset about that, you could put them on ariprazole, and that would help them not gain too much weight. Now, the same thing goes for loxapine. If you want to lose lots of weight, then take loxapine. Loxapine to lose lots of weight. And then also, if you want to be able to zip up your zipper on your pants, then you got to lose weight and take some ziprasidone, okay, zipper. So if you want to get your zipper up, then take ziprasidone to lose the weight, because that's also a low weight gain. Whereas these ones down here are high weight gain. And then we've got clozapine. Now there's something very important about clozapine. This closet actually belongs, I know it looks like a cool young man or something owns this closet. No, this is not the case. This closet is owned by a granny. Okay, an old granny owns this closet, because clozapine causes a granny or a granulocytosis. Okay, and she has seized this closet as her own. This granny has, so it causes seizures, and she has a good heart, myocarditis, and she also gets orthostatic hypertension every time she stands up, just like old ladies always do. So remember, clozapine, agranulocytosis. A granny lives in this closet. She's seized it for her own seizures. She has a good heart, myocarditis. It's inflamed or whatever. And every time she stands up, she gets dizzy, and that is typical at grannies. Now, remember, most people only partially zip up their zippers. Okay? Got that? Partial D2,5-HT or serotonin 1A, 2A antagonist. Partially zip up their zippers. And remember this partial. The other one that's a partial is ariprazole. Remember, clothes are only partially ripped. Okay? They don't get ripped all the way. That'd be crazy. They'd just fall off. But they're partially ripped. I think the rest is pretty good. I think we got it down. Let's move on. So now we've got our phenylthiazines, the chlorpromazine, Thior or Thor, flufenazine, the flying phone. We've got all this stuff tied into that one. And here he is up there, the typical corner. And then we've got our haloperidol up there with the typicals. And then down here we've got our atypicals. Remember, they're more serotonin than they are dopamine. Quetiapine Whisper, and here's our closet here that's owned by the old granny of agranulocytosis. And then over here now we're coming into our mood stabilizers. We're going to deal with lithium first. So here's lithium. I think of a lithium battery, and I remember that old Energizer commercial. Energizer is a lithium battery, and this lithium battery is running a toy. And when I think about toys, I think about little kids. Okay, so that's kind of a long train of thought there. Lithium, Energizer bunny, toy, kids. So kids, you think of these different ages. Now, this is important because different levels of lithium. By the way, lithium is used for bipolar disorder. I don't know if you ever noticed, most kids act like they have bipolar disorder. They'll go into mania. They'll think they can beat everybody up. And they'll be all, I used to think I was so tough when I was little, or, kind of have these manic episodes. Kids throw tantrums. Anyway, so kids think bipolar disorder. And lithium is a mood stabilizer. So, but it has toxicity risks here. Now, the common, normal lithium risks at any amount of taking it is going to be that when you take it, you start to shake a little bit. It gives you this tremor. Think of this lithium bunny shaking, okay? And then you think of thirst, okay? So this bunny's been going and going and going and going. Well, you must get thirsty, and so it causes the thirst, also causes the edema, and also causes weight gain. And weight gain is apparently the number one reason why people quit taking lithium, because they gain a lot of weight. So those are the acute common adverse effects, but there's adverse effects that are seen at different amounts of toxicity. So when a person gets to, usually they're supposed to be under 1 molar equivalent per liter in their blood, but if they get above 1, like 1 to 2 molar equivalents per liter in their blood, this is where they start showing the diarrhea, the vomiting, the drowsy, and the uncoordinated. And this reminds me of like a little baby, like a 1 to 2 month old or something like that. Or, so little babies, man, they're always pooping, they're spitting up all the time, they're always sleeping, and they're very uncoordinated. They barely even grab their own hands. So there we are. Here's a little baby, he's got diarrhea, okay? So 1 to 2, little baby with diarrhea. Drowsy, vomiting, uncoordinated little baby. And now when we get 2 or 3 years old, these older kids, they're usually, got things together. The only problem is that sometimes they'll still pee their pants, okay? And they also move funny. Little 2 and 3 year olds are running around all funny. So maybe you think of a little story here, and you imagine this 2 or 3 year old peeing his pants, because they make you pee all the time. And kids also have these high-pitched voices. It sounds like a ringing in your ears, so tinnitus. And they cry so much, this kid's crying that his eyes got all blurry. Sometimes I used to say, too, that when I had to pee really bad, I said, I got to pee so bad, my eyes are turning yellow. So maybe you could think of that, and maybe think of this kid having pee coming out of his ears. I don't know. That's 2 to 3. And then the 3 or more molar equivalents, that's gonna high mortality. They need IV fluids and hemodialysis, maybe go into a coma, seizures, arrhythmias, hypertension, all that kind of stuff. And just remember too, hydrochlorothiazide or any other diuretics, whatever, blood pressure medications, whatnot. Sometimes they can cause EKG to have the T-wave inversion. Okay, so now we're going down into other mood stabilizing drugs, and these are the anti-seizure drugs. So the anti-seizure drugs listed down here, and we've talked about Thor, we've talked about the Haloperidol, talked about our closet, talked about Orlando Bloom saying quiet whisper, we talked about our Energizer Lithium Bunny. Now we're talking about anti-seizure medications, particularly these aren't being, in this case, they're not being used for seizures, they're being used for mood stabilizers like bipolar disorder. So here's the ones we like to use. We like to use carbamazepine, lamotrigine, valproic acid, and divalproex, okay? So carbamazepine kind of sounds like carbs. So here's our carbs, and it also kind of makes you think of cars as well, but here's It's a carb, but this is the limousine or lamotrigine. Here's the limousine, and also our valproic acid. So one notable thing about valproic acid is that it causes increased ammonium levels, and I think of ammonia, I think of cleaning, so I think of acid, also used to clean. Here's a phosphoric acid cleaner. This is an acid cleaner, and you can also use ammonia cleaner. So tie in your brain valproic acid with increased ammonia levels, and tie carbamazepine. Think you made these carbs here with you didn't use very much salt, so hypo on the natremia or the salt. Hyponatremia is hyposalt. And then Stevens-Johnson syndrome. Stevens-Johnson syndrome is where you break out this horrible rash, and just think of this person got a rash because of the upholstery in their limousine. Okay, so now we're done talking about all those. Now we're going to move on to the benzos, or the sedatives and hypnotics. So we've got short-acting, intermediate-acting, and long-acting, and they're kind of broken up. These ones are going to be the alpha-hydroxymetabolites. These drugs here are going to be anxiolytics, or they're going to be for they're going to be for anxiety medications, and then these ones are the soporifics, which are for panic disorders. So going into these now. Over here is actually listing some details, but this is probably the important stuff you want to know. You want to know that the panic disorder here is being treated, or actually the real thing is going to be the anxiety disorder. The anxiety disorder, maybe agoraphobia or generalized anxiety disorder, that's going to be treated by alprazolam. So here's alprazolam over here, and then we've got our actual panic disorder is treated by clonazepam, which is one of the soporifics here. And then we've got our Midazolam, is a preoperative sedation. And if we go down here on the next slide, we actually have some things to help us remember that. Quick note though first, it's GABAA is what caused the influx of chloride. It's the alpha-1 subunit that's a sedative. Alpha-2 and 3 are anti-anxiety. People get anxious when there's too many people around. We can think about 2 or 3 is more. Anyway. Benzodiazepines, Ben likes it fast, so they open faster, whereas Barb likes it long, so they open longer. All the barbiturates end in barbitol, benzodiazepines, end in PAM. So first we have barbiturates. Let's see here real quickly. There's Barbie. She likes it long, remember that? Going on to our benzos. The one I really want you to remember here is going to be Midazolam. Okay, Midazolam is a sedative anesthetic, and just think this Bedazzler kind of sounds like Bedazzle, Midazolam, Bedazzler, whatever. So this is a weird thing they do to make jewelry, and I was trying to think, oh, well, what if they approve this thing for surgery so that you could implant these jewels and bedazzle yourself? Well, turns out the Bedazzler is now approved for surgery. So Midazolam is for surgery. It's a sedative. It's not really, of course, but okay. Now we're going on here. What we have is alprazolam, which here is represented by the Alps. Alprazolam, Alps. Oxazepam. These are the oxes. It's really oxen, but these are the oxes of oxazepam. And then we got lorazepam. So Laura, this is from a video game, I guess. Laura Croft, apparently. She climbs the Alps. So we've got Laura Croft climbing the Alps, or Laura. Laura's climbing the Alps. And on the Alps are these oxes. Okay? So the way you remember this is these are the 3 anti-anxiety drugs. So you think climbing the Alps would cause you great anxiety. She's very nervous about climbing the Alps. Okay? So Laura climbs the Alps with the oxes. So now we're going to focus in on the next. So we covered the Midazolam for this one. Now we covered here the lorazepam, alprazolam, and oxazepam. Now we're going to go into this panic disorder with clonazepam. Nothing can freak you out more than clowns. Clowns make me panic. So think clonazepam is for panic disorder. Clon kind of sounds like clown. Couple last ones to make note here. Buspirone, so it's bus It's second line for generalized anxiety disorders. I think a lot of kids get really nervous getting on the bus. They get a lot of anxiety. You have to use it 2 to 3 times daily, and it's a 3A4 drug. There's a couple drugs with Z's in them. Z's put you to sleep. Zeleplon and zopiclone. Zeleplon is a 3A4 and an aldehyde dehydrogenase associated with its metabolism, and zopiclone has a half-life of 6 hours. So there's some people catching some Z's. And then lastly, we've got some melatonin drugs or agents. They help you sleep. We've got the RAM. He looks tired, and RAM Meltion and Meltion. They just want to melt going to sleep, or melatonin Meltion. And here is Taz. He just makes me tired just looking at him. And that is the end. I hope you enjoyed. Hope that was helpful.